Hey everybody, it's Dr. D, mom of three. So excited that you're joining me today for today's show. Again, if you missed last week's episode, we talked about diabetes type 2 and just did a little snippet about taking better care of yourself and making sure that you do the right things and not letting that diabetes, or like one of my really good attendings who I trained with would call it the diabetes, get you. Before we go into today's show, don't forget that the Dr. Mom Show is a medical informational resource. It does not take the place of your provider or your child's provider's advice, so definitely seek medical advice from your physician or your child's physician. This does not take the place of that. All right, again, just to keep you posted. So I'm super excited because I recently had a trip to a Ms. CEO conference. I was one of the collaborating authors to a book called Ain't No Plan B. And you can get that book. You can definitely email me at drmomshow, drmomshow@gmail.com if you would like a copy of that book. It's 17 female entrepreneurs who collaborated to write that book. It's fantastic. It is about all of us sticking to our plan A and not going to plan B, so pretty much not giving up. So it's very encouraging. Then just a reminder, don't forget about my mom devotional, MOM, Meditate, Overcome, Motivate. Christmas is coming, the holidays are coming. You can always pick one up for Mother's Day or a birthday. And then also don't forget my best-selling children's book, The Tripsies and Me. Super excited about this one. This one recently got published. You can definitely check both of these books out on my website, www.dalenemushalak.com, which is listed right below in my comment section. Also, don't forget to hit the subscribe button to the bottom right of your screen. If you don't subscribe, share the video and share it with some friends. Well, we're going to delve right into our topic today. So today we are talking about high blood pressure, also known as hypertension. Okay, so what's pretty insane is that hypertension or high blood pressure is the most common reason why patients have an office visit for chronic or long-term medication. Isn't that insane? So that just shows you how many people have to go to the doctor because their blood pressure is high. Crazy. So if you're out there and you do have high blood pressure, or if your pressure is hanging right on that fence, this is for you, or to help somebody live a better lifestyle. So right now, in the most recent years, the numbers have kind of fluctuated as far as the diagnosis. They're leaning towards a little bit more tighter control for patients with high blood pressure. So normally, we just want you to try and keep your blood pressure less than about 130 over 80 is where we want it. So if you're hanging out in like the 120s, over like 70s, hit or miss, you're doing great. If you're starting to go up there, especially if you're going up to like the 140s and then the bottom number is the 90s, that's for sure not where we want you. Normally when you go in and you see a physician or a provider, we kind of give you the benefit of the doubt. So let's say you go to a visit and your number's slightly high, we give you a chance and then we recheck it. So normally we need 2 readings before we say that, you know, hey, we got to make some changes. Possibly you may need medication. And again, this is all up to your provider because there's multiple factors that affects this. So if you have other risk factors like diabetes, obesity, if you're a smoker, high cholesterol. So there's other things that affect whether or not you need to be on medication and how much will let you slide. And then the other thing too is, you know, diet, of course, kind of that diet you eat. So everybody is different. Even though we do have these set guidelines, we kind of take everything into consideration because, again, we just don't want to throw medication at you. We want to make sure that we're making good decisions when we treat you. So let's say you go in, but let's say you go in and instead of your number being slightly high and we're like, hey, we're going to give you another chance. Let's say that number's super high, like that bottom number is maybe 180. Sorry, that top number is 180 and that bottom number is maybe 100. Yeah, probably not getting a second chance. You probably will be starting on a medication or even 2 medications at that visit in order to bring it down, because again, like I talked about in the diabetes video, we want to try and get the best control of these diseases, because the longer that your body's having to compensate for these diseases, the more potential complications there are in your system. So I always tell patients, you know, even if I have somebody who comes in with their blood pressure that high, and let's say they need to be started on 2 medications, I tell them, I'm like, hey, you know, if you really work at lifestyle changes and things like that, there's a chance that you may come off both, one and even both. So don't think if you get started on a blood pressure medication that this is for life. Again, a lot of things play a role in it, like the risk factors I mentioned about smoking, obesity, family history, of course, your diet, your lifestyle, you know, those all play a role. So if those can be changed, definitely we try to change those. So before I move on, let's check out this week's Tripsy clip. We're going to start some potty training. We've officially got our little potties. Where's your potty watch? And we got these things called potty watches. Hey, Alina, can I see your potty watch? We'll have to put them on. Say hello. Oh, we got a little argument going on here. Where's your watch? There it is. Give that to Luke, please. Thank you. They're so crazy and adorable. I love those kids. Anyway, okay, now back to business. So let's say you go and you get this diagnosis. So a couple things. The other thing we may have you do is check your blood pressure at home, because again, home is your natural environment. You're more comfortable there. So if we see that your blood pressure is high at home, hey, no question about that. That's a no-brainer. That obviously you do need to be on medication, or your medication needs to be upped. So again, there's multiple reasons for high blood pressure. Again, like I said, genetics, lifestyle. Also, there's some secondary things. There could be another medication that could be causing your blood pressure to go up. Sometimes people can have what is known as an adrenal mass. So we have these little adrenals on top of our kidneys, and sometimes if there's a mass on there, that can increase it. So there's different reasons, and this is why it's important when you get diagnosed with high blood pressure, your doctor or provider may ask that, hey, they want to get a workup done, like a urine or other tests, and that's really just to help you and make sure nothing else is going on. So again, they kind of use their discretion as far as what all you need to get done. So as far as medications, let's say you fail lifestyle. So lifestyle changes that you can do include decreasing salt intake. So watch your sodium intake. So junk food, chips, anything that's salty. Don't forget that canned goods and frozen goods also have a lot of sodium in it in order to preserve those foods. And then of course exercise. Exercising, losing weight are huge. And then if needed, we start you on medication. So again, it is important to really watch out for your diet. Even if your blood pressure is not high right now, still watch your salt intake. Unless you're somebody who has low blood pressure, there's people out there where their pressure is low and we're like, hey, it's okay to add a little salt here and there. But really watch your lifestyle. There's other factors that could potentially be increasing your blood pressure, which include smoking, again, weight. Don't forget caffeine. So before you get your blood pressure checked, don't drink caffeine or smoke right before that, because that will also increase it. So definitely, again, just to reiterate, we need to take good care of ourselves, because again, high blood pressure can lead to heart attack, stroke, you know, loss of vision. It can affect the blood vessels in our eyes. So again, just a lot of things that can happen. Kidney failure. I mean, there's a lot of things that can happen. So again, take good care of yourself. The end of the year is coming near in a new year, but you do not have to wait until the new year to set a New Year's resolution. You can start something new right now. So definitely just watch your diet and exercise if you get a chance. Definitely check out whatever exercise routine you're doing. Check that out with your physician first before you start to make sure that you are good to go. And again, don't forget to wash your hands, kiss your kids, love your family, and say your prayers good night. Bye-bye.